Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we're announcing one additional death due to COVID-19. This is from the Winnipeg Health Region. I want to extend my condolences to their loved ones, their family, their friends, their caregiver. Our current 5-day COVID-19 test positivity rate is 5.2% provincially, 3.7% in Winnipeg. 66 new cases of the virus have been identified as of 9:30 a.m. this morning, bringing our total number of confirmed cases to 33,418. We're announcing one confirmed case to be a result of the B.1.1.7 COVID variant of concern. This case is from Prairie Mountain Health Region and has since recovered. Public health officials note cases of variants of concerns are announced following identification of positive test results. Once a screening and sequencing has been completed, they're not included in a new case totals announced daily. As of today, the vaccine eligibility age is people over the age of 65. I encourage you to call and go online to make an appointment today. I encourage all Manitobans to get your vaccine appointment as soon as you become eligible. Yesterday we reported 7 deaths related to COVID-19. I can confirm that 4 of these deaths took place between November and February. The death we are reporting today occurred in December. The deaths were reported to public health late last week following case reviews and notification from acute care providers. 2 deaths were linked to outbreaks that have since ended. One was a female in her 90s linked to a previous outbreak at Maples long-term care home, and the other was a female in her 80s linked to a previous outbreak at Misericordia Health Center. These reviews will take place from time to time, and our data is updated regularly. I can confirm that case investigations have linked cases identified as variants of concern associated with schools. Letters have been sent to 4 additional school communities to advise them of possible exposures. These include St. Paul's High School, Our Lady of Victory, Highbury School, and École Rivière Rouge, all in Winnipeg. The affected cases are all isolating, and classes and other close contacts are currently quarantining. Case investigations continue to determine any additional details about the initial cases and where they may have contracted that variant of concern. If parents and guardians have not been contacted by the school or public health, they have not been identified as a close contact. Public health officials do recommend monitoring the child for symptoms of COVID-19 and to seek testing if symptoms develop. Manitoba Education is updating their public dashboard system to report variants of concerns specifically and expects to have this completed by week's end. Public health will continue to work with close contacts and their families to help them understand the self-isolation requirements. I ask for everyone's cooperation with the public health measures in place to reduce the spread of this virus. We know that having a whole family isolate is quite challenging, but it is needed to reduce the spread of this virus. Starting tomorrow, March 23rd, all teachers and staff working in schools as well as licensed childcare providers are eligible to access a rapid testing appointment at the FastPass site, 1066 Nairn Avenue in Winnipeg, whether or not they are showing symptoms. We encourage staff to continue to be tested regularly to help continue to reduce the spread of the virus. This is helpful even after people get the vaccine, as we don't yet have a full understanding of the effects of the vaccine. So we continue to advise even vaccinated people to follow all public health measures for the time being. Of course, wearing masks, physical distancing, good cough etiquette will remain important for the foreseeable future. Manitobans are starting to plan or make their plans for spring break, Easter, Passover. Public health continues to advise against non-essential travel. If you do not have to travel, you're asked to stay home to help stop the spread of COVID-19 and the variants of concern. Easter and Passover are very common times for families to get together. We need to be cautious. We can think back to the issues we had following Thanksgiving in Wave 2. So our current orders allow for one other designated household or two designated people for the holidays to gather at private residences. Restaurants allow for households to eat together inside, while patios can accommodate up to 6 people from different households. Outdoor gatherings can be up to 10 people in addition to those from the residents. So I know this isn't how we wanted to spend our spring break or holiday weekend, but we do continue to need to be cautious with our case numbers slowly trending up, with the variants of concern becoming more and more an issue. We want to continue to open in a cautious manner, but we do need to do what we can to delay the transmission of this virus, delay a third wave as we are rolling out vaccine. So it's not going to be like this forever. We do have that optimism that we see the vaccines beginning to roll out, but we're still many, many weeks to months away from having enough of the population protected for us to really significantly reduce our public health measures. So thanks again for everyone's work, and happy to take some questions.
Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question this afternoon. Up first, from CBC Radio Canada, Zoe.
Hello, Dr. Roussin. The Manitoba League of Persons with Disabilities wants people 50 and under to be included in the government's action plan. What do you answer them?
You know, I think that when we're talking about the vaccine, the biggest roadblock we have right now is just the amount of doses. And so I think it's just when you have a scarce supply and there's many people who want this vaccine, then we're going to have difficulties trying to allocate it. So all of the modeling and the evidence shows that the most important risk factor, it's not the only risk factor, we realize that, but the most important risk factor is age. As we roll out this vaccine, it becomes more and more challenging the more exceptions we try to roll out. So what we're doing right now is trying to stick with the age-based program, get things rolled out. And you can note that we're traveling quite quickly down the age cohorts. So we saw today announcing again an expansion of the criteria. And so, it's very important that we get the most Manitobans protected. And by doing an age-based approach to this, for the most part, is our best approach. So we are getting that vaccine out, and as we get more and more vaccine, we're going to have more and more Manitobans eligible quite quickly.
As a follow-up question, or just another question, what are the risks of going into a third wave in Manitoba with the loosening of the restrictions that are possibly coming this week?
So we know that this virus is spread through interaction. And so really that was the goal of the public health restrictions dating back to our very first, during the first wave, is to reduce the way that we interact, especially outside of our household. And so as you loosen restrictions, you're going to see more and more interaction. And just like we see now, we'll see increasing in cases. Adding to that, we've now have these variants of concern, which are 50 to 70% more infectious than the wild type virus that we saw in the first and second wave. So we have to be really cautious. So any openings have to continue to be done in a cautious way. Any openings still have to be accompanied by Manitobans, continuing to follow the fundamentals. We have to keep our interactions down outside of our households, or we are going to see a third wave, and that's going to compromise our ability to rapidly vaccinate Manitobans. If we see increasing cases, that means we're going to see increasing hospitalizations and ICU admissions again, and then that means care for people without COVID again becomes affected because we're spending so much of our hospital resources on caring for COVID patients. So we have to be very cautious. But I think there continues to be that level of optimism moving forward with spring and summer approaching, with more and more vaccines approaching.
From CBC Manitoba, Jill.
Hi, Dr. Roussin. Canada's three westernmost provinces have seen rapidly rising cases of coronavirus variants, in some cases doubling within weeks. And health researchers that we spoke to are cautioning against reopening, saying it's the opposite of what provinces should be doing right now, suggesting we should expect the same surge here. What do you say to that?
Well, I think we have to be cautious. We've been cautious, and so just like this latest set of a potential easing of restrictions, we floated it to Manitobans who are interested in the feedback, and of course, every step of the way, we continue to follow things that are happening here and around us. So I think that we definitely need to be cautious as we move forward. We definitely have to be cognizant of the effects of the restrictions as well. So we always want to use that least restrictive means to obtain our goal, because these restrictions themselves have health impacts. So we're always trying to find that balance.
And with several Manitoba schools now advising of possible exposures to variants of concern, what message do you have for parents who may be worried about this? We're hearing from some parents who are keeping kids home today in light of news that there may be a variant of concern exposure at their school. So what message do you have for parents right now who might be worried?
I think, again, it's a message of caution that we have to be cautious the way we approach our loosening of restrictions. In schools, we've up to now had great results of preventing transmission of this virus, but now the variant of concern adds complexity to that. So I think we need to ensure we're sticking to the fundamentals. So, in schools, when we do our case and contact investigation, if there are contacts and cases identified, we need those identified to appropriately isolate for the appropriate amount of time. We need people to continue to watch very closely for their symptoms, to follow those fundamentals. And so we'll continue to follow the spread. But, right now, overall, our education system's been quite good at keeping the transmission of virus low in schools, and we'll continue to follow that really closely.
From CTV Winnipeg, Michael.
Hi, Dr. Roussin. Further to variants popping up in school settings, almost all of them recently are in the Winnipeg region. So at what point is the province considering closing the schools or the like? Is that on the table? Is there a plan basically already if these variant cases keep spreading within the school setting?
So we'd never have, any option off the table that we think is in the best interest of the health of Manitobans. We know there's a lot of benefit to keeping our kids in school, and we've been able to keep them in school for the most part during this second wave. And so we're going to continue to do what we can to keep the kids and the staff safe. I think right now we have an aggressive case and contact management, so we're going to have more and more people self-isolating in these schools, more and more cohorts being isolating along with their households. So we have a very aggressive approach to it. Just like in any other setting, if we start seeing increasing transmission, then we'll have to decide on what those next steps are. So we have in place, since summer. Plans, if necessary, for to respond to cases in school.
Thank you. And my second question is related to vaccinated individuals. Why not allow vaccinated people to essentially stop using masks and social distancing is there a percentage of the population that needs to be vaccinated where public health would consider recommending people stop using masks and social distancing?
So, yeah, I think the big message is that the vaccine is our, way through this pandemic. So the big message is, as soon as you are eligible for vaccine, make an appointment to get vaccinated. Encourage everyone to get vaccinated as soon as they can. Once we get more and more Manitobans vaccinated, we're going to start seeing that translating into our, case numbers. We're going to see that translating into hospitalization rates. Then we can consider how we're going to manage our public health measures based on that. Right now, we're nowhere near the population level coverage of vaccine to start making those decisions. So the big message is the vaccine is here. We're still right at this point not where we want to be with the supply of that. But I just encourage Manitobans, book your appointment as soon as you become eligible. The more and more Manitobans we get vaccinated and protected, then the more likely we are to start being able to lift these public health measures.
From City News, Stephanie.
Hi, Dr. Roussin, Stephanie from City News. We're just hearing from doctors in other provinces that are reporting higher numbers of young people admitted to hospital with the variant, and anecdotally seeing some more severe outcomes for that population. Is that what we're expecting here too? Like, are you expecting the third wave to have a bigger impact on young people?
We need to be prepared for that. The variants of concern are definitely more infectious. So they're much more easily spread than the wild type strain that we began with. And it's still early for definitive answers, but a lot of the reports we're hearing, like you say, that there may be increased severity, that we are seeing younger people be needing hospitalization or ICU admission. We're seeing longer stays in hospital. So we do need to prepare for that, and we do need to be on guard. And this is why we're taking very aggressive case and contact investigation and public health measures to try to do what we can to keep this variant of concern from spreading widely in our communities.
Okay, and you mentioned last week that there were some cases of the variant of concern where you weren't sure how they were acquired. In the cases of community transmission, how are they primarily spreading in the province?
Well, there's a number of settings. I think the primary place is usually in the gatherings right now, as we'll see that. So within and between households is the biggest type of gathering. But then we'll see, transmission take place really at any type of place where interactions take place. So you name the scenario, we've seen transmission in it. So we just need to continue to do what we can to limit the amount of interaction we have with people outside of our household. We're have the vaccine rollout, but we're still a ways away from having enough of our population covered before we can start relying on that. So for the time being, we're going to need to remember those fundamentals, decrease the amount of interactions we have outside of our household. We need to keep these variants of concern at bay.
From CHVN, Taylor.
Hi, good afternoon. Do you have any advice for people who are participating in Holy Week or Passover activities, and are they going to be considered a regular religious service?
Right, so if you're holding a regular religious service, those can certainly continue as per the public health orders, and they would have to abide by the gathering limits. And so the advice really is that we need to decrease the amount of interaction we have outside of our households. So we know this is a time for people to gather with their families, with their friends, with other people from their community. This year, again, unfortunately, is going to have to look different. And so we need to keep those gatherings down and really follow the fundamentals and follow all the public health orders related to private residences, related to faith-based gatherings. We just don't want to see that third wave start because of similar gathering that we saw, for instance, during Thanksgiving weekend.
And this is the second year in a row people won't be meeting as usual for these major holidays. Do you have any words of encouragement for those who are struggling with this?
Yeah, I think it's been challenging for a number of reasons, and probably this pandemic has strained all Manitobans in one way or another, and so yet another holiday that's going to need to be celebrated differently. We are really hoping this is going to be perhaps the last one that has to be celebrated this substantially differently anyways. But we're still months away from the vaccine uptake that we need. And so we need to continue to follow the public health orders, continue to follow the fundamentals for a bit longer. Or else we risk going into that third wave and compromising our ability to really have that good spring and summer.
From the Winnipeg Free Press, Danielle.
Hi, Dr. Roussin. You previously said that public health, your focus will shift from daily case counts to hospitalizations as more people are vaccinated, but hospitalizations are a lagging indicator. So will public health introduce interventions, for example, maybe a circuit breaker before the impact is felt in hospitals, and how will you know when that is about to occur?
Right, yeah, and so I mean, for the until we get a significant proportion of the population covered, we can't simply rely on that. We're going to have to continue to follow things like test positivity and case counts. Once we see more and more vaccine uptake, we're going to be able to get that sense of what proportion of daily cases require hospitalization. And so once we get into more and more stable numbers, then we will be able to judge that better. We'll be able to know what the lag is and what to expect. But yeah, right now we're not in a position to simply look at that because we just don't know what to expect.
Okay, thank you. And we're opening up rapid testing to staff at schools and daycares for asymptomatic surveillance. When will the province introduce more proactive COVID testing, say, within daycares and schools or in workplaces or high traffic areas for surveillance as reopening continues?
Yeah, I think there's, we are continually working on ways to increase access to testing and different formats. So rapid testing, asymptomatic testing. Just like any public health approach, we have a multifaceted approach. So we have the public health restrictions, we have our public health measures, we have testing. So it is one of the components of this. And so we are looking at trying to expand that because really the goal is to try to continue to reopen things despite this virus and try to find ways to limit the spread. And so rapid testing is just yet another tool that we're going to try to utilize for that.
From Global News, Brittany.
Good afternoon, Dr. Roussin. Brittany from Global News. We are in spring now, and with spring comes allergy season. Is there any way for people to determine if they have allergies or if it could be COVID-19? Are there specific things people should be looking for?
This is a challenge last year as well, and I would say that the biggest thing is we should be erring on the side of caution. Right, we don't want to miss a COVID diagnosis that was mistaken for allergies. So we know that leads to people with allergies being tested, but again. We don't want to miss cases. So things like typical symptoms. Typical time of year, are things that people could look for. But I'd be very cautious on, explaining away symptoms due to anything but COVID for the time being. I think we should err on the side of caution, knowing that there are some people with very stable symptoms, very predictable symptoms that over time will be able to make that judgment. But for the most part, I would err on the side of caution still.
Thank you. So given that is the recommendation that if you have any symptoms now that you should still be isolating and going to get that test, or is there things that people can, look for and just say, oh no, I know for sure that's just a runny nose, or is it everything right now, go and get tested?
Yeah, I would still take the online screening tool. Take the online screening tool, and if it suggested getting tested, I would get tested at this point.
From the Brandon Sun, Michelle.
Good afternoon, Dr. Roussin. I'm wondering if you have any information about the Keystone site in Brandon not taking appointments now and in coming days. Is it a lack of human resource capacity or a lack of vaccine?
I don't have any specifics on that. What I would say is that for the most part, the rate limiting step of our entire vaccine program is vaccine right now. So our vaccine task force has the ability to ramp up daily doses as soon as we get those doses. And so I don't know the specifics of this, but for the most part, delays, in appointment booking really has to do with our access to vaccine right now.
Okay, great, thanks. I'm wondering also, are we still on track with the proposed changes to the health orders and the possibility of downgrading to level orange, despite the positivity rate for the province-wide is above 5 again, and we have upcoming holidays. What's your take on that right now at the beginning of the week?
Well, I think we have to be cautious. Whichever direction we go, we're going to have to do so very cautiously. And so we're going to be out tomorrow to announce some of those specifics that we've decided on. We're going to review the results of the Gauge MB survey and take a look again at following our numbers, which we always do. So we'll have more details on that tomorrow.
From CJOB, Marnie.
Good afternoon, Dr. Roussin. You've said repeatedly that people should get vaccinated as soon as they're able, but there's some concern that some are either holding off on getting the vaccine until it's in a more convenient location, or holding off so they can get the brand that they want, I guess. Are you concerned that that's causing people to delay getting vaccinated, and what's your message to folks that might be doing that?
Yeah, I'd be concerned with any hesitancy to get vaccinated. I think that this is clearly our best way to start lifting our public health measures. And so as soon as you can get vaccinated, I would get vaccinated. And I would get vaccinated with the first brand of vaccine that's offered to me. All of the approved vaccines in Canada are safe and they're effective. And so as soon as someone was eligible, let's make that appointment. Let's get vaccinated. Let's encourage our friends and family to get vaccinated. This truly is our way to a spring and summer with very little restriction.
Okay, thank you for that. And just following up on one of the last questions that was just asked, you're going to be releasing more details about restrictions this week, but what is the likelihood that you're going to delay loosening this round of restrictions until well after, like giving a buffer period to allow for a kind of a period after people might gather with spring break and Easter coming up?
Yeah, so we have to remain cautious. That's all I can say right now. We're going to have more details on that as early as tomorrow. So right now, I'm not, going to, speculate on what our sort of final approach will be, but we'll have more on that tomorrow.
From the Winnipeg Sun, Glenn.
Yes, Glenn Dawkins from the Winnipeg Sun. Dr. Roussin, the 7 cases that were reported, the 7 deaths that were reported on Sunday, can you go further into that? Some of them date back to November. How were I don't want to say missed, but how are they now, it's just sudden, or not suddenly, how are they now coming to light? And the other, just back up from earlier. The death that was announced today, was that part of this 7, or did I misunderstand you?
Well, it's the death report today is an additional death, in addition to that, but also took place in December, and so our surveillance team receives reports from different providers regarding reports of deaths, and that's how they get into our numbers. If those reports are delayed, then a reporting on it is delayed. So I don't know the specifics on this. I think that over time we do receive updates and additions, and you've also heard us actually remove some people who were reported as deaths and then ended up not being related to COVID-19. So it's just a matter of data being updated, and I think that I don't know why there was sort of this they all came at one time there. So we do our best to try to keep things update. Unfortunately, we've had had to report over 900 Manitobans lost to COVID, and so this was a sort of a data adjustment to that.
And according to the email or the release that was sent out about the vaccine update, the province seems just shy of its mark of the 20,000 doses administered daily, I think, or the maximum. Obviously, you look at that as a positive sign, but how do you look at that?
Yeah, I think the vaccine program right now, I think we have to look at it in a positive light. It's really our way through this pandemic, and right now the reports that we have is the only thing limiting vaccine right now is vaccine supply, and we have optimistic views that in the near future we're going to be getting more and more vaccine. And we'll be able to start administering that as soon as we receive it. So I do think the message right now is we have to be cautious, but that shouldn't take away our optimism. Right? We have spring, summer coming. We have plans to get the majority of Manitobans vaccinated fairly quickly. So I think there needs to be that level of optimism. I think Manitobans need to see that there is hope. We just can't let up right now until we get more and more vaccine.
And our final reporter this afternoon from the Verdun Empire Advance, Anne.
Hi, Dr. Roussin. Based on some reports that I've been reading from around the world, there's been some licensing of ivermectin as a treatment. That comes from Slovakia. The health minister there licensed it in January, I believe. There's been studies by a Dr. Laurie, she's a medical doctor, and a evidence-based medicine consultancy limited specialist in the UK, and she's done meta-analysis. So there's indication that ivermectin is fairly effective in prophylaxis and a treatment to some degree, reducing deaths from 30% to 5% in some cases. What do we know here in Manitoba about ivermectin and the research going on there?
Yeah, so there's still not a lot of information on this. Ivermectin is a drug we use for various purposes here. But not being used right now for COVID-19. I've read articles in peer-reviewed journals, and the evidence is equivocal at this point. So I think throughout this pandemic, you can list a number of medications: hydroxychloroquine, ivermectin, azithromycin. People are want to get out of this pandemic, and it'd be great to have a treatment. A medication that can get us out of this. Right now, I don't think there's significant evidence that tells us that ivermectin is that drug. But we'll continue to review that, and again, this is on the clinical aspect of it, so it's not really public health that's deciding on these things, but our clinicians on the front line that are actually treating people in hospital and treating people in ICU pay very close attention to emerging treatments for these for this condition, and so we'll continue to watch. But at this point, the evidence is still lacking.
Thank you. That's good to know. But can you tell me why or how are the strains of concern or variants of concern? What makes them 50 to 70% more transmissible? What do they do? Does that mean we have to stay 12 feet apart? What method of transmission has changed with them?
Yeah, so it's a good question. And so with these type of viruses, especially RNA viruses, they mutate over time, they change over time, and so there's a number of ways that a variant could become more infectious. One of them, and in this case, is the mutation just affects the part of the virus that binds to our cells. So every cell has to bind to our cells to be taken into the cell to start infecting. And this mutation, a conformational change of that binding area, just makes it more affinitive, more sticky to our cells. And so that's really why this virus has the strain has become more infectious. There's other ways that viruses could mutate to do that, but that's the method here.
Thank you, Doctor. This concludes our media briefing.